All right. Am I good to go?
Yeah, whenever you're ready.
All right. So for my capstone, I did applying data analytics to Maryland's COVID outbreak. My table of contents, standard stuff. So the introduction. Since March 15th, Maryland has been in lockdown because of the coronavirus. And because of this, it's been a constant thing on my mind, keeping me tethered at home, keeping me away from things. So I thought that since I'm spending a lot of time thinking about it, I would tie it into my capstone project and use it for something productive. So for my problem statement, uh, I analyzed the data of Maryland's coronavirus cases, deaths, and vaccine distribution, and I used that data to make visuals, ask and answer questions, and make supply chain recommendations about Maryland's response and how things have been going so far and what we can do in the future. So a little bit of background. First, these are all the phase days. So starting on December 14th, 2020, we had phase 1A, and healthcare workers, law enforcement, and firefighters, other first responders were allowed to get the vaccine. On January 18th, we went to phase 1B, so individuals 75 and up, any disabled and intellectually disabled people, and teachers K through 12 were allowed to get the vaccine. On January 25th, we rolled it out to postal workers, grocery store workers, transportation workers, anyone in labs and food production. On March 23rd, we rolled it out to people 60 and up. And then on March 30, we went to phase 2B, which expanded it to individuals 16 up with underlying medical conditions. And then we're doing a pretty decent job, so we skipped phase 2C, and on April 13th, we went into phase 3 with everyone else 16 up, and that's where we are currently. A little bit more background, these are the days where we had changes in our lockdown procedures. So on May 27, 2020, restaurants were allowed to open back up at limited capacity. On June of that same year, malls, gyms, and casinos were allowed again at limited capacity. On August 27th, schools were told to begin the process of reopening, and on January 21st of the next year, schools were told to be expected to return to hybrid learning by March 1st. And just recently, on April 28th, the outdoor mask mandate has been lifted. So we'll get into the data now, starting with vaccinations. So our average daily vaccination rate has been steadily going up, which is good. On April 30th, the last day I collected data, we were at a 32.81% fully vaccination rate. Just another side note, I collected data from February 1st to April 30th, so over a 3-month period. And you can see in the graph to the bottom right, we have our fully vaccination rate is following a nice exponential curve up, and hopefully it will follow that trend. And on the graph on the left, you see we had the most first dose vaccinations in a day on March 19th at almost 45,000, and we had the most single doses on April 12th with that big spike down there at 14,659. So then we'll get into the data by age. So if we look at cases among all the ages, each age group had some cases. The younger people had more cases than the older, but on the flip side of that, anyone 50 up was much more likely to die from contracting COVID. And 96% of all deaths in Maryland occurred in people 50 up. If you want to move that a little bit further, looking at people 40 up, 99%. So if you're under 40, you really don't have to worry about dying from this unless you have any underlying medical condition. Another interesting point to bring up about that is that you see in these two charts that 1,920 people 80 up contracted COVID in Maryland, and of that number, 626 died. So almost a third, 32.6% of people 80 up who contracted COVID died from it. So it's very deadly to older people whose immune systems are weaker. So now we'll look at the data by county. So I have a nice chart of all the counties in Maryland. The most cases were spread around these middle counties here: Baltimore, Montgomery, Prince George's, and Anne Arundel. And then as we get into the lessly dense populated areas, the number of cases went down, as it should with any viral disease. More and more people packed in an area, there should be more cases. But then if we look at the deaths by county, some places, like for the most part, the places with more cases had more deaths, obviously. But you look at Frederick, that had 75 deaths and less than 3,000 cases, and then you look at Howard County, that had more cases than Frederick, but way less deaths. So it probably has something to do with Frederick having an older population, since this virus kills older people more than it does younger people. So getting into my analysis, I came up with a couple questions that I wanted to answer by the time I was done collecting all this data and going through it. So those are: how long will it take Maryland to reach a 25, 50, 75, and 100% vaccination rates? Will the average number of cases each day decrease as more as the population gets vaccinated? Or will new strains of the virus and poor public and government response make it spread faster? Are the counties with the most cases getting more of the vaccine? And how can the supply chain be improved to address the challenges Maryland faces in vaccine distribution? So, starting with first question, we reached a 25% fully vaccination rate on April 16th. And I would estimate that we'll hit the 50% fully vaccination rate in about a month, since our first doses are close to 50%. And the Pfizer takes 3 weeks for your second shot, and Moderna takes 4 weeks. So in a month from now, everyone who has the shot now will have their second shot. People who get the Pfizer this week will have their second shot, and adding on anyone who gets a single dose, we should be at 50% in about a month. It's going to take a lot longer to hit the 75% rate, because you have less of the population who are willing to get the vaccine, and it's just harder to find people, since so many people at this point will have already been vaccinated. It's harder to find and get those people that still need the vaccination to get it. And we're never going to reach 100% vaccination rate, because there are some people who either don't believe in vaccines for religious reasons or personal reasons. So that 100% rate is never going to be a thing, but hopefully we can get enough to get back to normal life. To answer the second question, cases are fluctuating recently, but they have been on an upward trend. So even though we're about at a third fully vaccinated, we still have the same number of cases throughout this 3-month period. It shows that people are, getting sick of being inside, being a little bit more risky, and the cases still aren't going down, which I would have thought they would have. For the third question, that's a yes, that the counties with higher cases are getting more of the vaccine, as you can see in this Pareto chart. Montgomery, Baltimore, Prince George's, Anne Arundel, and Baltimore City, the top 5 case counties, also have the most vaccines. They got the most vaccines. So it's good we're getting the vaccines out to the most highly affected counties. And then to address the last question, so for the first part, I wanted to outline some of the challenges the Maryland supply chain faces, which are, of course, production volume, getting enough tests and vaccines out to our citizens, storage of the vaccine, because the vaccine needs to be held in specific freezers, and it can only be out for a certain number of time. Like once you mix the vaccine, you can only leave it at room temperature for 6 hours, and then it goes bad. So in that 6 hours, we need to get however many doses are made out to people, and then distribution to the counties and people that need it. So for my results, vaccinations are happening at a rising rate, which is good, but I do expect it to slow down in the next couple weeks, in like the next 2 months. Once we hit the 50% mark, I expect it to slow down from there, still rise a little bit. And then once we get up to around 60, it's probably going to plateau. Cases are continuing still, as we still have over half the population still not vaccinated, and people are getting sick of being inside and want to get out and do stuff, and they think that, like, everyone so many people have been vaccinated, it's safe to go outside. Things are opening up. As we open more up, as the mask mandate gets lifted, that's like people think the government's telling them it's okay to go outside. And then deaths are continuing at a constant rate. I'd like to first for some data to back that. We had throughout the 3 months I collected data, there were 1,047 average case was the average case number every day, and on April 30th we had 942 cases. So it's not really getting so much better, even though we have about a third of the population vaccinated at that point. And the average deaths per day over the 3 month period I collected data was 18. And on April 30th, we had 25 deaths. So again, as we're getting more vaccinated, it's not really affecting these case and death numbers because we have a big population and not enough people are vaccinated and people are still taking these risks. So for the supply chain recommendations, my first recommendation is we need better communication across the board from the state. Uh, as a little example, when my brother went to get his first shot, he overheard the doctor who gave him the shot on a phone call saying that he had 500 doses of the vaccine he needed to give out today. So he must have mixed them today. He had 6 hours to give them out, and he didn't have people to give them to. And this was weeks ago when it was still incredibly hard to get a vaccine or to get an appointment to get a vaccine. So there's a lot of miscommunication between, the CVS's, the Safeways, the physicians, and the state, and we need a better way to do that. I was seeing on Twitter that people were posting pictures of like the Hagerstown mass vaccination site being nearly empty and telling people, like, even if you're far, go drive there, they've got space. And that should be something the state should do and not be left up to individuals on social media to do that. So we need better communication across the board. They need to be talking to people. They need to be, emailing, getting out on news, getting out on radio, social media, anything to help people get these vaccines. The second recommendation is to improve efficiency and reduce bottlenecks. Another little anecdote from personal experience: when I went to get my vaccine at CVS, it took me a couple minutes to find out where I needed to go to get the shot in the CVS. They needed, and that couple minutes per every person can make a lot of time in the long run. And also, uh, the volunteer writing my information on the vaccine card took a little bit longer than I expected him to do that too. So, if we reduce foot traffic by making better signage, and maybe we could implement like people will input their data online before they come in the shot, and then once they get there and we verify they're there, we can print out their data and put it like on a sticker on the card. Anything to save a couple minutes for every person would make a huge time saving in the long run for getting everyone vaccinated. And then the third recommendation is just open up more locations. I had to drive uh, around 30 minutes to get my vaccine, and that was the first appointment I found after a couple of days of looking after I was able to get my vaccine. So if we can really just get more locations, even like a small number at a bunch of locations could help people, because if someone is much more likely to want to drive 5 minutes to the local grocery store or CVS, do a little shopping, get the vaccine, instead of having to drive an hour, 30 minutes away to these mass vaccination sites and then have to drive back. It's all about convenience and making it easy for people. So for my conclusion, I'd say that Maryland did a better than average job responding to this. If you look at the data from the CDC about all the states, Maryland was 44th in cases per million population, so in the top 10 there, because you want to have less cases. 35th in deaths per million population, and 11th in tests. So we were up there in the top 15 for all three. And it could have been worse. There's still a lot of room of improvement. If they take any of my recommendations, really just need better communication across the board. That's the biggest thing, because I know a bunch of my family, my friends just had trouble finding vaccination appointments. My mom is a teacher, and so she's been able to get it for a while, and it took her over a month to find a vaccination appointment. And then, following the data, I think that the end's in sight for the virus and the lockdown. Things are looking optimistic from here. If you had asked me a year ago, I would have been a little down. There's no knowing when this would have ended, but I think in a couple months we'll be back to normalcy, and in a year we'll probably be back to normal. So I got most of my data from coronavirus.maryland.gov, the government website, and some of it from the CDC. And I'd like to thank Professor Yao and Dr. Scala for helping me out and advising me. So if you have any questions, I'd be happy to take them now.
Sure, Rami, I had a question. Can you please go back to